With the recent death of George Floyd, we've been faced with a heightened awareness of the frustration and sense of hopelessness many Black and brown Americans are feeling related to our nation's long history of systemic racism. While the protests and outcries have largely centered around societal ills related to generations of oppression and discrimination, it has brought additional attention to the large racial disparities in health outcomes as well. We take care of people from all walks of life and cultural backgrounds, and I believe the people I work alongside each day are passionate about providing excellent patient care to all people. After all, we chose healthcare as a career path to help, not harm people. However, despite our efforts, there's still a lot of work to be done. There are many things we must learn about our patients and each other. Having open dialogue about race is exceedingly difficult. People worry about asking questions that others might find offensive. Some of us are apprehensive about admitting when we don't understand another person or group of people's perspective. We are challenged to listen and to be empathetic when we don't completely understand. It's very uncomfortable. I must admit that being out front on these types of issues creates some discomfort for me as well. I feel extremely vulnerable sharing the concerns I have around race for my husband and children. I worry about others' perceptions of me when I voice my opinion about race, and to be completely transparent, I worry about how that might impact my career through the years. However, these times now require us to initiate difficult conversations. Together, we must work together to understand the history that contributes to the racial disparities that exist, from safe housing, educational systems, food deserts, rates of incarceration, and health outcomes. In order to understand the distrust people of color have of healthcare and healthcare providers, we must all learn how our implicit biases that we all unconsciously have, impact our interactions with our patients and their interactions with us. In order to understand the distrust people of color have of healthcare and healthcare providers, we must educate ourselves on the history related to, for example, the Tuskegee syphilis experiment, Henrietta Lacks, and the history of coerced sterilization among Hispanic, Black, and Native American women. These are events in fairly recent history, and they shape how people of color receive care. We may not be responsible for the history that's contributed to this moment, but I do believe we all have a responsibility to start having open and honest discussions with one another to promote positive change in our organization. Many people have said they treat everyone the same and they don't see color. The truth of the matter is, what we look like, whether it's race or gender, shapes our life experiences and our perspectives. And sometimes it negatively affects how people are treated. Our family dynamic, our socioeconomic level, religion, the places we have lived or visited and worked all contribute to our perspectives. We are all equal, but we have to acknowledge our differences. Closing the gap in health disparities benefits all people. As an organization, we must develop strategic long-term plans around culturally competent patient care, implicit bias training for caregivers, and diversity and inclusion programs that help us identify the needs of our patients, regardless of race, religion, or sexual orientation. Only then will we truly be able to continue to live up to our brand promise of exceptional care, simply delivered. Thank you very much.
The recent events surrounding the death of George Floyd is a reminder to me that racism and ill treatments of African Americans are very prevalent in the USA today. On a personal note, I've had a few patients referred to me in the past who refused to see me because I was Black. Fortunately, my colleagues were able to convince them to see me for their care, and they did. I'm glad to say that I'm still seeing these patients today and we get along very well. They gave me a chance. My concern is for the future of my children and others who are not Caucasians or come from different backgrounds. How safe is the USA for them in the future? African Americans are not asking for anything more than to be heard and treated with dignity as human beings created in God's image. Far too often I hear my Caucasian friends say, "I'm not a racist." And I agree with that because I know these people very well. But my question to them is, are you listening? Can you walk in our shoes for a moment? You may not be a racist, but you have to still reflect and ask yourself, what can I do to end discrimination? I think we all need to do better at giving people a chance and not looking at their skin color or accent to make our judgments. Being silent is not an option. And in fact, I would say that being silent is being complicit. Thank you.
With the initial death of George Floyd, it showed me yet another thing that I have to be careful about. His death was caused by an assumption that he had used a fake $20 bill. And so now it just revealed yet another thing. I have to be careful jogging in my neighborhood. I have to be careful driving. I have to be careful shopping. I have to be careful enjoying nature. I have to be careful with everything that I do, because any encounter can lead to a police encounter, which can lead to my death. And that is a challenging thing to have to deal with on a day-to-day basis, but it is a reality for myself as a Black man, as well as many other Black men and women. What we as healthcare providers need to hear, and what we need to hear is that systemic racism is real, implicit bias is real, and most of the healthcare systems, including our own, are influenced by both of those things. The problem with implicit bias is that it's implicit. We often treat Black patients much more distantly, with much more scrutiny. Often the Black patient is going to be ignored in comparison to their white counterparts, or really any other ethnicity. We know that there is a healthcare disparity in the Black community, and the COVID-19 pandemic has done nothing but exploit that, where the Black population in America is only 13%, but the vast majority in a large number of cities of deaths have been amongst Black patients. And so the awareness aspect is vital, because if we don't know what our problems are, then we cannot fix our problems. So thank you for listening, and I hope that this begins a conversation, not just about a problem that we're dealing with, but how to fix the problem that we're dealing with.
In my own personal experiences, when I've shared my own personal stories of racism, it was often met with skepticism and disbelief. It often felt as if people thought I was lying. I mean, seriously, if George Floyd's death was not recorded, who would believe that they saw an officer place his knee on a man's neck for 8 minutes, with other officers looking on in broad daylight, with people watching? Sounds unbelievable. But what I will tell you from personal experience is that when you share such a story with someone and they believe that you're leaving something out, or they have all this skepticism and doubt, that really, really hurts. It makes it worse. It's one of the reasons I believe that people choose not to tell their stories. So all I'm going to do is ask those of you who are listening to me today to just, well, listen. Do your best to try to suspend your doubts and your disbelief. Now, I was also asked, what do we as caregivers need to hear with regards to the Community Health Network on these issues? So I would say that our network is often thought of as a colorblind institution, and I believe that's a fair statement. I've met many who have said that they were raised to see no race and no color. Unfortunately, if you don't see race or color, you're at great risk of not seeing that the experiences of others may not be the same as your own. And as a result, you may not see or recognize the challenges that they face. For this reason, I would support adding an additional D to our Pride values, a D for diversity, to let us all know that it is something that we value. Evidence shows that diverse organizations are more successful. We must recognize that inequities exist in our society and be willing to shift our resources to help those most in need. It would be consistent with our Pride values, especially if we add another D. So I look forward to future conversations, and thanks for listening.